everyone. Greetings, everybody. I'm Shreya from Beautiful Spotless Skin Team. I'm sure all of you must be keeping good health. You must have come across people, especially women, with brown colored patches on their face. They seem like like spots forming large, flat patches. This is nothing but melasma. Melasma is a common chronic skin condition in India. According to study conducted across 4 Indian cities, revealed that more than 80% of the population present skin color heterogeneity on the face, irrespective of age and gender. This heterogeneity mainly results from hyperpigmentation spots and melasma. Indian skin tone more susceptible to pigmentary disorders. It occurs mainly in women, 90% and 10% of male of all ethnic and racial groups. Around 20 to 30% of 40 to 65-year-old women present a facial melasma. Melasma and hyperpigmentation generally ignored as sign of aging and often misunderstood skin condition. Melasma sufferers have been misinformed about aspects of this common hyperpigmentation issue. This can lead to frustrating setback in treatment. To avoid all these hassles and to keep you informed today, we are here about management of melasma from expert. Dr. Farheen Khan is a skilled consultant dermatologist at Government Medical College, Rudrapur and Zil Clinica, Delhi. She earned her MBBS from ELMC Lucknow and completed her MD in DVL from KBNU FOMS in 2022. Dr. Khan specializes in advanced cosmetology and began her private practice in 2022 at a charitable hospital in Rudrapur. She also serves as an advisory member for AZ Healthcare, fostering global collaborations in dermatology. Known for her patient centric approach, Dr. Khan combines her clinical expertise with empathy to provide personalized solutions for her clients. She stays updated on the latest advancements in dermatology, incorporating modern techniques into her practice. Her work reflects a strong commitment to excellence in clinical outcomes and patient satisfaction. In addition, she contributes her time to MAK Hospital established by her family in memory of her grandfather, reflecting her dedication to community service. Today, we are privileged to have her with us, and she will be sharing insights on melasma and its management. We extend a heartfelt gratitude to you, Doctor, for joining us. Without further ado, over to you.
Thank you so much for kind introduction here.
Thank you, Doctor. Can we go ahead with the questions?
Yeah, sure. We can discuss.
Sure. Can you please let our audience know what is melasma?
See, melasma, let's first understand the word itself. So, it is been derived from a Greek word named melas, which actually means black in color. So, melasma is derived from mainly that Greek word, and it's kind of symmetrical hyperpigmentation, which is present over the malar area, especially in females of reproductive age group and those who are exposed to intense UV radiation like UVA, UVB, and also those who are belonging to the Fitzpatrick's type third to sixth skin. So yeah, so melasma especially occurring during the reproductive age. It's very rare that it's happening more than post-menopausal also.
What are the causes of melasma?
Causes, see, it's a multifactorial condition. So it's a kind of hyperpigmentation, as I've said, that it's mostly present over in the females, those who are exposed to the UV radiations, that to the intense sun exposure. And
Mhm.
sometimes there can be, if there is any hormonal disbalance in the body, like during the time of pregnancy, as we have seen, which is known as cloasma. So
Mhm.
there is excess of estrogen and progesterone hormone level, so that's why it also can occur during that time. And if the person is on some certain drugs like phenytoin and
Mhm.
barbiturates, tetracyclines like minocycline, doxycycline, so those people can also develop melasma over the face. And people who have not been into the proper skincare at a desired age, then also
Yeah.
they can develop melasma, and there are like various causes you can say.
Okay. And what is the actual difference between melasma and hyperpigmentation? Are they both the same or are they different?
Melasma per se is a type of hyperpigmentation only, but
Mhm.
it's acquired. It's specific, and then it's only present over the face, and
Okay.
mostly it's seen in the face and central facial, and then malar area, and then mandibular area. But
Yeah.
hyperpigmentation, let's say, is a broader term. It's like any damage happening to the skin in
Mhm.
form of either the person is taking oral medication or if infection has occurred, or any injury has occurred, or if the person is suffering from any disease, or any sort of discoloration is happening due to any abuse in the body, then is a broad term we would say that hyperpigmentation is there. So
Okay.
I don't think so it's any different than hyperpigmentation, but melasma is also one type of hyperpigmentation itself.
Okay, that's really useful. And what are the major signs and symptoms of melasma occurring, doctor?
Since we will have to keep in mind, since I've already said that melasma is a type of type of hyperpigmentation, so the signs and symptoms can always overlap. But yeah, there is a category where melasma can be either only centrofacial. The
Mhm.
pigment, the discoloration is always in the form of hyperpigmentation, and then it's centrofacial. That can be the forehead, can involve nose, upper lip chin area can be involved. Only that happens in like some around 63% in the Asian woman, or Fitzpatrick type 3 to 6, or it can also occur over the malar region in some around 20 to 21% of the people, especially in females, and also it can occur in the mandibular region in 16%, and sometimes it can be combined also, which can occur all over the face. And also it's always, the color is always patchy, and there can be brown to grayish discoloration occur, and then there are always symmetrical patches in case of melasma, where hyperpigmentation can always occur. It can be generalized. Sometimes there can be uneven skin tone, and then there can, a post inflammatory hyperpigmentation can also occur due to some dermatitis, some infections. And then again, as I've told, if the person is on any sort of drug, that can also cause hyperpigmentation. So you'll get to know, the patient will himself will tell you that after starting certain medication, he has started to develop such hyperpigmentation. And then
Oh,
hyperpigmentation is a broader term. Like if I start about hyperpigmentation, we'll have to, go on to the nutritional deficiencies also, and then sometimes lymphomas, Addison's adrenal gland insufficiency can also occur. Hyperpigmentation can cause hyperpigmentation, and then it's a broader term. Like hyperpigmentation has so many signs and symptoms depending upon the cause on it.
mm.
Yeah.
Okay, doctor. What are the actual risk factors of melasma?
Risk factor for melasma, we'll talk about risk factor, then I'll tell you about the prognostic factors also. Risk factors again, female, from age between 15 to 64, and then during the time of reproductive age. And then if there is, they are not into a proper skincare, if they are not applying sunscreen, and if they live in a area or work in the area where there is intense sun exposure for them. And then if they have been, contact sensitizers, like these days you will get, like we get patients, the kind of patients we get. So most of them are from melasma, whosoever have got melasma, they've already applied some of the steroids or triple combinations already. Then they come with the pigmentation. So those people who have, unknowingly or unwillingly have applied some cream over the top, which has caused some sensitization and then leads to pigmentation, those people are more prone to have melasma into their skin. And yeah, those who's having habit of smoking, who's having habit of alcohol, and then those people are more at the risk of developing melasma
Okay.
altogether.
What are Okay? How do we actually diagnose melasma, doctor?
See, first we have to first see the clinical picture, the site of area involvement. So it's very easy to diagnose melasma, but sometimes we get confused with, hyperpigmentation causing only over the face. So first we need to see the clinical picture, what type of melasma exactly is happening. Then there comes wood lamps. So it's a wood light. It's kind of a visible examination where we see the pigmentation where it is deposited. So mostly epidermal type of, there are three types of melasma, let me tell you. So epidermal, dermal, and mixed type. So only it's not a like significant scoring we can tell due to woods light we can find. But yes, still if it is epidermal type of melasma, we can get to know through woods lamp. And then comes dermoscopy. Dermoscopy again, we can differentiate between the types of melasma, where we can see what exactly the cause of melasma is there, because there is sometimes increased vascularization over the epidermal and dermal, and then we see the patches. So there we can check through dermoscopy, and then comes the this reflective confocal microscopy, where we can see the deposition of the melanin pigment through the clinical pictures. So it's very easy. And let's say biopsy, I wouldn't say very commonly, but very rarely we take the biopsy, where we can see the pigment deposit into the layers.
Okay.
So all of these we can check that how and where and what level of melasma is occurring into the patient.
That's really great, doctor. But how do we treat the disease melasma when it comes to the treatment parts?
Uh, First, we need to find out the cause, that how the patient got the melasma. We need to first seize the cause. Let's say if the patient is on drugs, we'll tell the patient to immediately stop the drugs and find the alternative. And then we'll give a proper skincare to the patient. And there are, first line of therapy, second line of therapy, and then third line of therapy. And then there are few more newer, products have been introduced recently. And then comes the procedures and then lasers. So in first line, we will give the skincare, sun protection. We have to provide. We have to counsel the patient properly. We have to give them products containing mainly kojic acid in it, at least 2 to 5%. Hydroquinone is the mainstay, but we have to be very precautious while using hydroquinone, since it causes furthermore pigmentation, which is known as exogenous uchronosis. So we have to be sure that we have not given hydroquinone for not more than 4 months. And then along with that, we can add azelaic acid, the creams formulations which contains azelaic acid in it, which contains licorice in it, which contains as this glycolic acid, especially 5 to 10%. And then comes combinations as in that it will contains a maximum, like kojic palmitate. It will contain vitamin C in it. It will contain lactic acid in it. So all together, there are few combinations available in the market what we give. And then we can also give oral supplements, where we have started to give potent antioxidants. And along with them, we have also been tranexamic acid is one which is giving promising results in cases of melasma, since it directly inhibits the alpha melanocyte stimulating hormone, which actually is producing the pigmentation. So it directly inhibits that. Just the only thing we have to be precautious while giving tranexamic acid is that we have to check on the clotting profile, the blood profile, the platelets, bleeding time, clotting time, and INR, all of that, especially during the time of for the patients, those who are in the reproductive age group. And we have to counsel the female patients to stop the oral tranexamic acid drug during the time of menstruation cycle.
Okay.
Because, and yeah, so the dosage can be like, we can start with 250 milligram per day, and we can also increase it to 500 milligram. And but it has to be consistent, like for 6 months at least we have to give, along with the skin care and also the topical solutions and the creams. Then
Okay.
comes chemical peel. So this was just, it's like melasma is very stubborn kind of pigmentation, where there is no no end of the products we can use for melasma. But yeah, if you know when and where to give the products and the treatment, you can do better.
That's
So
really.
yeah, so chemical peels. So nowadays you'll start to see on the social medias, and you'll get to know, and whosoever patient has come from those people who are in parlors, they have also started to do chemical peels, but they don't know that how priming is very important, like how much it is important. So we always prime the skin before going for any sort of chemical peel, any sort of laser, or any procedure for the face, especially in case of melasma. So hydroquinone is the best gold standard priming agent for melasma, where we already started at least 3 to 4 months before chemical peels and stop it at least 2 weeks before. Likewise, tretinoin is also one product which we always give to prime the skin, but it can be stopped at least like 1 week. That is fine, and also restart again after 1 week of chemical peel. Then with it, we can also add glycolic acid and azelaic acid in it again, and TCA is also one. TCA We have, but we do not give it for the pigmentation part, but we only use TCA for its caustic property. So if we give lower strength, 15% of it only, not more than that basically. And then there are
Oh,
new more products which have been introduced in the form of antioxidants and anti-inflammatories, and some are unsaturated fatty acids. Like we usually consume it in our daily diet, like green tea extract, like coffee beans, mulberry extract, strawberries. All of these have like antioxidant along with them depigmenting properties, which really helps in melasma. And
oh,
pycnogenol is also one which is the latest and the very new this thing product being introduced, where it is actually extract of French pine bark, which is having again the depigmenting property and gives you little glow.
okay.
Yeah.
How do we actually prevent the disease melasma, doctor?
Since prevention is always, to start with the skincare at a very early age. Sun protection is main. We have to tell the patient if they are, living in an area where there is intense sunlight. So we have to counsel them to wear full clothes, a hat, and at least wear the mask if possible. If they fall in the category of the Fitzpatrick's type 3 to 6. So that is one thing. And then we have to tell the patient always to have fruits containing antioxidants. We have to tell them to use proper moisture, and they can always go to the dermatologist to keep a check whether their sunscreen is good, whether their the depigmenting nowadays it's like a trend to use serums and depigmenting creams. So they have to be they have to confirm it with their dermatologist whether whatsoever cream or serums they are using for the skin care, if it is good, or will it cause further pigmentation. So
Yeah.
all of that is the prevention mainly. We have to be very particular in our skincare.
That's very true. There are
Yeah.
like these some misinformations about melasma and hyperpigmentation. So, can you please enlighten on us on one by one questions where can melasma turn into cancer? Being the first one.
Yeah, there are many, like, yeah, never, like, it will never turn into, because it has nothing to do with the cancer. And since it is not a precursor of cancer at all, melasma is a complete different entity. So I don't think so. And it's not even there in the studies yet.
That's nice. So, is it due to
Yeah.
some allergy or infection that occurs?
Of course not. See, it's a condition again, I would say. So it depends upon your lifestyle, it depends upon the area you're living, it depends upon the care you are taking care of skin. So it's not at all any allergic or infective. Yeah, post-inflammatory hyperpigmentation can definitely occur, which can, mimic the melasma, but if it is occurring only over the face. But no, it has nothing to do with the infection or allergy.
True. Is melasma a hereditary disease?
Yeah, there have been studies, there are some, preponderance or genetic predilection can be there. There are few genes like, tire gene is there, MITF gene is there. Some of the genes are there which are actually responsible for the hereditary causage of the melasma.
Okay. Can this melasma be permanently cured?
Since, like, the permanent cure for the melasma is very challenging, but we can always support it with the type of treatment as we have discussed, and we have less time, so otherwise I would have explained more about the treatment. So yeah, it can also be controlled by using the right amount and right type of product, and the procedures you're getting done from the doctor, like chemical peels, some of the lasers, and the maintenance therapy is always required. So make sure that the patient whosoever is having melasma should always keep a check on their products by a dermatologist on time.
Okay. There are a few questions by our viewers, doctor. Whereas, can melasma occur on other parts besides the face, and can makeup be used after we are diagnosed with melasma?
See, no, it's a complete facial predilection. It's a complete facial involvement. It doesn't occur on the other parts of a body, since we have already discussed about the hyperpigmentation. So melasma is a type of hyperpigmentation which only occur bilaterally over the cheek and face area. It doesn't even go down the neck.
Okay. Can makeup be used during this, or can this be treated with vitamin C?
Makeup again, I would say that makeup should be dermatologically tested. And then again, I'm so sorry. What was the last question you said?
Can
Vitamin C.
melasma be treated with vitamin C?
Just a second, yeah. So, see, makeup can always be applied, but priming is important, right?
Mhm.
Priming and the treatment is completely different than the makeup you're applying over the face. You have to always use your, face wash, moisturizer, sunscreen, or the serum you are using. And vitamin C, let's say, vitamin C is having a depigmenting property. It can support the treatment of melasma, but it cannot, be used as the treatment of melasma. So it is just a supportive treatment to the mainstay.
Sure. And how
Yeah.
can diet influence the appearance of melasma on our skin, doctor?
Since I just told you that green tea, like and diet, like you can eat anything, but you should consume more of fruits and rest of the vegetables which have higher antioxidant properties in it or depigmenting properties. So like there nowadays, like blue tea you will get to hear, chamomile tea you will get to hear, green tea you will get to hear, even coffee beans extract and black coffee, all of that contains flavonoids in it, which are like a really good antioxidant, and that fights with pigmentation really well. And then there are hesperidine, some of the food contains hesperidine in it, then again is a bioflavonoid. So that's why we say that always a black tea, a green tea, or a black coffee is best than the tea you are mixing it with milk. So tea without milk is always better than this thing, having with milk. And then again fruits containing citric acid in it, and the antioxidants again, like this lemon juice, this pineapple is really good, avocado is really good, kiwi is really good for the skin, strawberry again is like one more if you consume strawberry, it gives you glow along with the depigmenting properties. And then it contains also gentisic acid, which is also an extract of it. And then coffee, again, I told you black coffee is really good. Oranges are really good. Papaya, again, it has salamarin property in it, which is again an antioxidant, anti-inflammatory property.
Yeah.
So food, especially the fruits, is really good for depigmenting kind of.
Okay.
Yeah.
Okay. Viewer Pujri Gaikwad has a question for you, doctor. It is, can melasma return after treatment?
Yeah, since I told you that the treatment itself is very challenging and it can always return if you are not following a proper skincare and whatsoever your doctor has recommended. So it can always reoccur.
Okay.
Yeah.
So, any take home or closing remarks that you'd like to give for our viewers, doctor?
Yeah, the only one thing I would want to say to the viewers is that please do not use any sort of serum, any sort of creams that has been posted online, that has been people are nowadays just to sponsor, they've started to mm, show it online and then post it on their Instagram. So do not use any of the products they are showing. And then rest, do not ever go to a pharmacist and ask for the depigmenting cream just because you have some event. Doctors, especially the dermatologists, I don't think so that they will always give you a better and a good product that will suit your skin type and also is always treating the pigmentation. So that is one thing I would say. And always wear sunscreen, which is actually ideal for your type of skin. And also the serums you are using, you can discuss it with the doctor. They can be, the skincare is there, like cost effective skincare is always there. So you can discuss it with the doctor and get it always.
True. There's another question, doctor. How can I get rid of melasma, and is topical creams the only therapy for it?
No, topical cream is not the only therapy, but yeah, if you have recently just started to develop melasma, I believe that yeah, only the topical creams can still cure melasma. But you always have to prime your skin and go further for the chemical peels. Nowadays, now we get to know, there's one more, this Obagi blue peel has been introduced, and then, Cosmelan peels. They are always giving you best results along with the topical creams you have applied previously, at least like, 3 to 4 months before. And then if you don't like the chemical exfoliation process, then you can directly go for the laser session. That intense pulse dye laser is also there. Q switch ruby laser is there. Q switch anti-ag laser is there. Q switch 1064 laser is there. And some ablative lasers are also there. So depending upon your requirement, there are other treatments available, of course.
That's great, doctor. The final question that I'd like to ask you is, can I prevent melasma from getting worse by avoiding sun exposure as such?
Yeah, but how much sun exposure will you avoid? So you can prevent the melasma, but you cannot treat the melasma by avoiding the sun exposure after it has occurred. But you can
True.
always prevent by avoiding the sun exposure.
Definitely.
Yeah.
Thank you so much, Dr. Farheen Khan, for your valuable time. It has been very informative session for our viewers, and it is great to have you here. We really look forward for many such sessions from our viewers in coming time. Thank you, viewers, for your participation for today's session, and stay connected to our beautiful spotless skin page. Thank you.
Thank you so much for giving me such opportunity. Bye. Have a good time.